So everyone probably has heard this whole concept of flattening the curve. I just wanted to spend a moment to explain it. This is a diagram that looks at the daily number of cases within an epidemic as it peaks to the top number of cases you might see over time since the outbreak, and then eventually comes down. This blue line is critical. This is the line in which healthcare systems lose capacity to care for people. They run out of beds for hospitalization, they run out of beds for ICU. Now again, everyone across the world, including across Canada, are preparing our hospitals for this, to bring this line up as high as possible. But to really affect change, what we need to do is blunt this curve. We need to keep the number of cases low enough that we never overwhelm our healthcare system. And that means that we never run out of ICU beds or hospitalizations for the people who need it, people who are most vulnerable for this infection. To do this, we actually are spreading out, making it longer. But it's very, very important that we do that so that we can take care of these patients. And you have to remember, many of these people are healthcare providers who get sick as well. So the actual capacity to care for people, doctors, nurses, and others, gets reduced as well. So how do we do that? And this is where I kind of want you guys to look at this code, and you could follow along with me. I'm going to actually click on this and see if this works to bring it over. So it's all this whole concept of social distancing. So far it looks like it's working. This is a phenomenal article from the Washington Post. I suggest everyone reads it. It really explains why everybody, whether you have IBD, whether you're an elderly person, whether you are 20 years old, why it's so important to do social distancing. So there's a few simulation models that they have here. I'll just scroll down here to the first one. So what you can see here on this model is that blue people represent healthy people. These orange people are sick. And you can see purple people who come a bit later on as they recover. And in this simulation model, you're letting people move around anywhere they want. They can go to school, they can go to work, they can move around, go shopping, go to a bar. And what you can see here, quickly, you get your peak very, very fast, overwhelming the healthcare system. Now compare that to the simulation model where we enact social distancing. Here, what we can see here is the same model, same characteristics and everything, but one huge difference. Look at all these stationary dots. Look at all these people who are at home, not protecting themselves and society from getting infected. You can see it takes a lot longer to spread the virus in this area. People are recovering. You can see the curve is flat enough that we don't overwhelm our healthcare system. And importantly, people who are also vulnerable, people who are elderly, people who have IBD and immunocompromised are also being protected.